This week, the American Academy of Pediatrics released data showing an alarming increase in COVID-19 cases in children.
Yeah, and tonight medical experts say that creates an increase in a risk that is unique to children. CBS 4's Ty Russell joins us now with the details on this. Ty.
Well, Jim and Lauren, statewide, we've seen numbers go as high as 30,000 when it comes to the number of children with this virus, and that's just ages 14 and younger. And today, one doctor here locally is saying not only are we seeing an uptick in children get COVID-19, but also we're seeing an uptick in those getting really sick. The recent surge in coronavirus cases also means more children are getting the virus. Some of them have been getting really sick.
We anticipated this happening a couple of weeks ago. The unknown here is how many cases we're going to see and over what period of time.
Dr. Ronald Ford is the chief medical officer at Joe DiMaggio Children's Hospital. Miami-Dade and Broward have seen more than 11,000 children ages 14 and younger with the virus. More than 130 have been in the hospital. Dr. Ford says some of the children battling COVID-19 suffer from MIS-C, or what's called multisystem inflammatory syndrome in children.
It's very rare, but it can be quite serious. And so seeing more and more cases of it is quite concerning to us.
So far, the Children's Hospital has cared for 19 patients with MIS-C, but more than half were from this month.
I'd seen 9 between the middle of May and the beginning of August, but now in just the last 2 weeks, that number has doubled.
The illness usually occurs 3 to 6 weeks after contracting the virus. It's still unclear why it happens to some children. The most common symptom is a really high fever and simply looking sick.
When they come in with high fevers and ill appearance, even if they did not have a documented COVID-19 infection in the past, they should still consider this as a possibility.
Doctors are treating MIS-C similar to how they deal with Kawasaki disease found in infants and young children. They use medicine and steroids.
They require medications to help support their blood pressure, their kidney function, and sometimes their cardiac function.
So Dr. Ford says he wants parents, teachers, and fellow doctors to be aware of the illness in children with COVID-19, and he unfortunately says it's likely hospitals will see more sick children. And today we should also note the doctor told us that all of the children cared for at this hospital with MIS-C, well, they've all recovered. We are live in Hollywood. I'm Ty Russell, CBS 4 News.